So welcome, Carrie. Thank you for joining us today. Happy to have you. Just to give a little color to the context of how we're going to do the format today, we are talking about returning to work, and as New Jersey does start to open, albeit at whatever pace you feel that is, whether fast enough or not fast enough, it is pro-business, and so we at SKC are excited about that. So Carrie is going to talk today in three buckets, really. A little bit about workplace safety, which is what needs to happen before any of our employees or even any of our customers are put back into our organization. She's going to talk about returning to work and what does that look like. Do we need to stagger people's schedule? Do we need to have reduced workforce in the office space? And then finally, policies and procedures. So what new policies and procedures do we need to have in this environment with the changes and the new COVID and diseases and things out there? So we're going to open up with some general topics from Carrie on each of these three buckets. We do have some pre-submitted questions in each area, and then we're going to open it up at the end of each section for questions. For those of you that have been on our office hours before, you know that you can either physically raise your hand if you're on camera and we can see you, or you can utilize the chat function and chat in your questions, and we'll get to those throughout the presentation as well. So with that, Carrie, this is your platform, and let's start a little bit about workplace safety, shall we?
Absolutely. Thanks so much for having me. We spend all day. We have 25 attorneys, and nowadays we spend most of our day talking about how to get people back to work. And every business is going to handle it a little bit differently. It depends on if you are in a professional services office. It could be different if you're in retail or restaurants. They have specific guidelines. It's going to be different if you're in a warehouse or a distribution center. It's different in healthcare if you're an essential business. But we've been counseling businesses and walking them through this process really since day one, because those essential businesses have been operating for the last 3 months. But for those of us who have been able to work remotely or have most of our team work remotely, thinking about returning people to the physical location is going to be a little bit time consuming. And it's unfortunately not just a matter of, turning the lights on and welcoming people back in. So as Sarah mentioned, we kind of think of it in three different buckets. And the first bucket is workplace safety. It is definitely the biggest category and the most time consuming category right now, because you have an obligation under the law to provide a safe work environment for your employees. And COVID-19 has been recognized now in the eyes of the law as a workplace hazard. So when you're talking about workplace safety, things you need to think about are, what type of screening, either health screening or physical screenings, are you going to be doing for people before they can come into your offices? What type of reorganization of your office space are you going to have to do to allow for safety and social distancing measures? What type of personal protective equipment are you going to require, and are you going to provide it, or are you going to require that people to provide it themselves? What type of cleaning and disinfection protocols do you have in place? Putting into place a workplace safety and complaint process so that if people have concerns, they know who to go to so they can be addressed. Having an infection control and response plan in place. I mean, this virus is still spreading. It is relatively easy to spread as far as we understand from CDC guidance right now. So inevitably, someone within your organization is going to get the disease. And so what is your process? If that person has been in your workplace, what are your protocols? You have to be able to act quickly. What are you going to do in response to that? Also, even those of us in professional services will be welcoming people back into our office, like clients and customers and visitors, having a visitor policy as part of providing a safe workplace, thinking about business travel and any restrictions on that. And most importantly, once you have this plan, coming up with how do you communicate all of this to your employees or to your visitors or to your customers. So that's the first bucket, and we probably could talk all day about that, but I know we want to get to questions. So let me just touch briefly on the other two buckets. The second one is, how do you decide how and when to bring people back to work? A lot of businesses have either furloughed individuals, put them on like an unpaid leave of absence. They may have terminated people's employment, or you may have people working from home. And how you bring those people back to work depends on your particular business, but things you have to think about are scheduling, compensation, use of PTO, and And so different businesses are handling it differently. Most likely, I mean, in some of the businesses where we have been able to open up in New York and New Jersey, there are restrictions on the number of people that can be in the offices or in your facilities. Thinking about how do you select who returns and when, and how do you communicate that. Also, you need to think about handling how employees, those employees who refuse to come to work or can't come to work for health reasons or childcare reasons. And then the third bucket is really what policies and procedures do you need to get in place ahead of time before you actually have people coming back into the workplace. And that includes things like the workplace safety and complaint policy, fine-tuning your work from home policy if you don't have one already or you anticipate people are going to continue to work from home for a while, a visitor policy, a traveler policy, and also the paid leave, paid family leave and sick leave. There's been a lot of changes of those laws as well as new laws that apply to small businesses. So thinking about what that means for those employees who you recall back to work. What are they entitled to as far as potentially paid time off if they can't work for a particular reason? So I think that's kind of a high-level overview, but I definitely want to be able to answer your questions. So Sarah, why don't I turn it back to you?
Yeah, thank you, Carrie, for that introduction. There is just so much out there, and I know the biggest concern with so many of our clients and business owners on this call is really what's our exposure as the business owner? What liabilities are we opening ourselves up to? Because the first reaction is, oh my goodness, we can open again. How great, how wonderful. And then we stop for a second and we realize, well, what is that going to mean for us if this, and this happen, right? So let's talk about the PPE. You mentioned that in the beginning, right? The personal protective equipment. We've heard, obviously in New Jersey specifically, wear masks, wear masks, wear masks. So how, as an employer, do we need to handle things like that as far as, are we required to provide it? Are we required to mandate that our employees and or our customer or clients wear it? How does that interplay with HIPAA when you talk about doing temperature checks before you let people into your office? Could you talk a little bit about that?
Sure. So unfortunately, there's very little specifics in the law that define how an employer has to provide a safe work environment. The first thing is you have to follow whatever state or local guidelines are issued. So for example, in New Jersey, there are very specific guidelines that have been issued by the governor with respect to the return of restaurant and retail. And some of those requirements do specifically say, your employees, your restaurant employees, for example, have to wear masks. So you need to look at any specific guidelines that have been issued. The second, for all businesses, the Occupational Safety and Health Act, also referred to as OSHA, contains what's called a general duty clause, and that requires all employers, regardless of size or what you do, to provide your employees with a workplace that's free from any recognized hazards that are causing or likely to cause serious physical injury or death. And the CDC has recognized that COVID-19 is that such, of hazard. So we recommend that, you follow the CDC guidance on dealing with COVID-19 because that's all that's really out there. And that includes wearing masks, following proper hygiene, having hand sanitizer, hand washing stations, follow social distancing as much as possible, and screening for symptoms. And so it's recommended that you set up an employee health screening protocol. It may include temperature checks if someone's coming to work, but it depends really on your particular business, the volume of employees you have, when your employees come in, are they able to social distance? For example, do people have their own offices? So maybe wearing masks within someone's individual office is not required, but wearing masks in the common areas are. Again, it's not required right now by law unless you're in a specific industry to provide masks, but it's definitely going to be recommended that if you want your employees to follow certain protocol, that you provide them with what they need. So that would be, providing them with masks, hand sanitizer, cleaning supplies, and things like that. So you need to, if you're going to put that into place, there's definitely a ramp up where you need to start ordering that and organizing that and have someone who's in control of, distributing that within your office. As far as the HIPAA concern, you would ask me about whether or not, HIPAA, the health privacy law, comes into play. There's no HIPAA issue unless you're a healthcare provider. But what the EEOC has said, and that's the Equal Employment Opportunity Commission, is that it recognizes that COVID-19 is a serious threat in the workplace. And so it's allowing employers to require employees to disclose their medical information related to COVID-19, and it is allowing employers to require, if they want, employees to be tested for COVID-19 before returning to the workplace. However, like all medical information, employers do have an obligation to protect the confidentiality of that information. So that means that any medical information about employees should only be shared with others on a need-to-know basis, and any documentation that you have regarding an employee's medical condition should be maintained in a separate file, separate from their personnel file.
And so how does that, you spoke of, use the term health screening or screening of employees before they come back, and in some cases that doesn't mean that you have a checklist and a clipboard that they have to pass a test, but they may, disclose if they have symptoms and they have to stay home. That could be part of your policy. How does something like that extend to vendors that may be coming into your office? So for example, at SKC, we have the Shred-It team that comes in and empties our Shred-It bins, and we have the water cooler delivery person that comes in and delivers our water bottles. So how do we safeguard against, outsiders that we don't really have control over coming in, as well as, protecting our internal team that may be in the office?
Sure. So we recommend that you have a visitor policy that identifies who is going to be permitted into the office. So that means, for one, your employees need to know who it is that they're allowed to invite into the office, and there should be some control over that. I think in days gone by, if you wanted to invite someone to your office, you didn't have to kind of clear it by anyone. You just, said, hey, yeah, meet me at my office. Now, for right now, there needs to be more of a centralized system for clearing who it is that's allowed in the office, to make sure, number one, for capacity concerns, you don't have too many people in the office at once, and also so that there's a centralized process for vetting or providing notice to those visitors about your protocol. So similar to, say, an employee screening, a health screening protocol, we recommend that you have a visitor screening protocol, and that be shared with visitors or with your vendors that regularly come into your office space. If you have, for example, if you have any of these symptoms, or if you answer any of these 3 or 4 questions, yes, then you're not going to be permitted into our offices, and that policy should be shared, like I said, with your vendors before allowing them in, and it should be shared with any visitors who are invited. So that could be clients, that could be potential clients, customers. We recommend that notice be posted at the entranceway of your building or of your office space, as well as to those that are invited, and it be shared with them ahead of time so that they know they have to bring a face covering, or that they're going to be expected to stay within a designated area, and that they confirm they don't have any of those symptoms. And it could simply be, here are the questions. If you answer any of these questions, yes, please let us know and we'll reschedule the meeting. You're not going to be allowed into our office at this time.
And what would those questions be? Because I know the CDC guidelines are a little bit vague, but is it symptomatic of how you feel? Is it where you've been as far as travel goes? If you could possibly narrow down, what are sort of the top 3 questions that should be?
Yeah, the type of questions that we're recommending are, have you been diagnosed with COVID? Do you have any of the symptoms, and identifying the most common symptoms as are identified by the CDC? Have you traveled to an area in which there is community spread of the virus? Or is anyone in your household been diagnosed with COVID or demonstrating any of those symptoms? Those are the kind of the key questions that you want to be asking as the screening questions.